Ozempic, also known by its generic name semaglutide, is a medication primarily used for the treatment of type 2 diabetes. It belongs to a class of drugs known as GLP-1 receptor agonists, which works by mimicking the actions of the naturally occurring hormone glucagon-like peptide 1 or GLP-1. This hormone helps regulate blood sugar levels by stimulating insulin production, reducing the secretion of glucagon, a hormone that raises blood glucose levels, and slowing gastric emptying. Now, Ozempic has been the topic of discussion in recent months as a miracle weight loss drug that gets people to shed body fat without much effort. With all the hype surrounding it, is it really the miracle everyone claims it to be? Or is there something dark and sinister lurking behind the curtain, waiting for its chance to rear its ugly head? Let's take a look at what the research says and consider the pros and cons of Ozempic. I will link the studies below if you want to take a look at them yourselves. Let's consider the pros of Ozempic. For one, it is effective in controlling blood sugar. Ozempic has been shown to significantly improve glycemic control in individuals with type 2 diabetes, making it an effective option for managing this condition. At number 2, we have the one that most people are interested in, which is weight loss. In addition to its effects on blood sugar levels, Ozempic can lead to weight loss, which is beneficial for overweight and obese patients with type 2 diabetes. Another pro that doesn't get mentioned as often is the cardiovascular benefits. Clinical trials have suggested that Ozempic can reduce the risk of major cardiovascular events such as heart attacks and stroke in people with type 2 diabetes who have established cardiovascular disease. Now, let's consider the cons of Ozempic. The use of Ozempic has been shown to induce gastrointestinal side effects. The most common side effects of Ozempic include gastrointestinal issues such as nausea, vomiting, diarrhea, and constipation. These side effects can be bothersome and may lead to some patients to discontinue treatment. Another big con is the risk of pancreatitis or inflammation of the pancreas, which, although is rare, is a serious condition and requires immediate medical attention. Another big con is the cost and accessibility of Ozempic, which can be a limiting factor for many looking at this drug as the panacea to their weight-related problems. Ozempic can be expensive, and its cost may not be fully covered by all medical aid plans, making it less accessible to some patients. I have a link in the description to an online pharmacy group where you can get it online, but you'll probably need a doctor's prescription and your medical aid details if you want to order it from them. They are based in South Africa and deliver nationwide. Check out the link in the description below. The next con is that it's injection-based. Ozempic is administered via injection, which may be a drawback for individuals who are uncomfortable with or have difficulty administering injections. So if you're squeamish with needles, then this is probably going to turn you off big time. The last con I'm going to discuss is the risk of developing thyroid tumors. Ozempic carries a warning about a potential risk of thyroid C-cell tumors based on animal studies. It is not recommended for use in patients with a personal or family history of medullary thyroid carcinoma in patients with multiple endocrine neoplasia syndrome type 2. Now, let's consider the next topic for discussion. If someone uses Ozempic and achieves their goal, is it advisable for them to make any lifestyle changes so that they can keep their results, or should they just continue with Ozempic indefinitely? When considering whether to continue Ozempic indefinitely or make lifestyle changes after achieving weight loss goals, it's important to consider several factors based on the information provided in the studies as well as some general medical guidelines. When choosing to continue with Ozempic indefinitely, here's what you need to consider. Firstly, the effectiveness in maintaining weight loss. Ozempic has been shown to be effective in maintaining weight loss when continued over a period. In a study, participants who continued with Ozempic after an initial weight loss phase experienced further weight loss compared to those who switched to a placebo. Secondly is the management of type 2 diabetes. For patients with type 2 diabetes, continuing Ozempic can help in managing blood sugar levels effectively alongside its benefits in weight management. Thirdly, is the cardiovascular benefits. Continuing Ozempic might offer cardiovascular benefits, which is significant for those with type 2 diabetes and obesity who are at an increased risk of heart disease. Here's what you to consider when making lifestyle changes. At number 1 is sustainability and health. Relying solely on medication for long-term management of weight and health may not be sustainable. Lifestyle changes can lead to more permanent improvements in health and well-being. The next thing to consider is diet and exercise. Incorporating a balanced diet and regular physical activity can enhance the effects of Ozempic and help maintain weight loss and overall health. Lifestyle interventions were part of the study protocols and contributed to the outcomes. Another big factor is that lifestyle changes can help in reducing your dependency on medication. Making lifestyle changes could potentially reduce the dependency on Ozempic, especially if the underlying health conditions like type 2 diabetes are well managed. What are my recommendations? The first thing, as always, is to consult with your healthcare provider. It is crucial to consult healthcare providers to make a personalized plan. The decision to continue Ozempic indefinitely or stop it should be based on individual health status, the presence of any side effects, and overall treatment goals. The next recommendation would be to make a gradual transition and not to discontinue everything all at once. If deciding to stop Ozempic after achieving your weight loss goals, it should be done under medical supervision. A gradual transition to lifestyle management can help maintain the benefits achieved through the medication. Also, don't neglect to monitor and adjust. Regular monitoring of health parameters is essential when making the changes to the treatment plan. This includes monitoring blood sugar levels, weight, and other relevant health indicators. My final recommendation would be to incorporate some aspects of lifestyle intervention, regardless of whether Ozempic is continued or not. Incorporating lifestyle changes is beneficial. These include a healthy diet, regular physical activity, and other modifications tailored to individual health needs. Exercise in particular has been shown to improve a whole host of health aspects, from fitness and cardiovascular health to mental health such as depression and anxiety. Plus, you get to look good too. If you want to make some healthier lifestyle changes and want to do it a bit faster and easier, then check out our Habit Shift program at nutrition.mybetterbalance.com. Habit Shift is a structured 22-week program that delivers daily challenges in 11 different categories. So each category lasts for 2 weeks. These challenges are designed to build on top of each other and get you to adopt healthy habits in such a way that is fun, easy, and automatic. You will start adopting healthy habits and eliminating bad ones without even realizing it or feeling like you are putting yourself through hell. This makes it super easy to start living a healthier, more fulfilling life. Check out Habit Shift in the link in the description. In summary, Ozempic is a potent medication for managing type 2 diabetes with additional benefits for weight loss and cardiovascular health. However, it has the potential side effects and may not be suitable for all patients due to its mode of administration and cost. Both continuing Ozempic and making lifestyle changes have their merits. Often, a combination of continued medication and enhanced lifestyle changes might be the most effective strategy, depending on individual health conditions and goals. Always make such decisions in consultation with healthcare providers and tailor the approach to personal health needs and circumstances. If you found this video helpful, then like the video, subscribe to my channel, leave a comment, and I'll see you in the next one.